will continue to our second panel of this webinar, and I would like to give the floor to Dr. Busnatu to share his unique insights on cardiovascular disease burden in Romania. So, Dr. Busnatu, the floor is yours.
Hello, thank you very much, Victor, and thank you to Professor Pinto for showing us the Europe vision in terms of cardiovascular diseases. I represent basically the eastern side of Europe, and as you previously seen in the map that Professor Pinto showed to us, and I also attached a map related to the cardiovascular risk around Europe. The Eastern Europe, it's in the red zone in terms of cardiovascular diseases risk. And this is mostly due to the fact that we have a lot of challenges. And I'm going to speak a little bit about the challenges that we are facing in Romania and also in the closing countries. Challenges that put us at the level of 60% mortality each year in terms of cardiovascular diseases when comparing it to the other causes of death. So we have a very high prevalence. It's a big health problem. There is a limited awareness around this topic because we have a national plan of cancer, like Professor Pinto said. Everyone is speaking about cancer, and we all know that cancer is a really big burden for the society, but too little people speak about the cardiovascular diseases. On top of that, we have the healthcare infrastructure, which is old, which is from the communist period, and the infrastructure that has not been developed further and improved in terms of digitalization, which is very much needed in order to improve the medical services. Eastern countries have a big problem on shortage of healthcare professionals, especially doctors and especially nurses, which are leaving the country due to the low incomes that are provided inside Romania. On top of that, Professor Pinto spoke about prevention programs. Eastern European countries don't have secondary prevention programs. They don't have cardiac rehabilitation in order to put the population on track after a myocardial infarction, after an operation on the heart, or after a heart failure hospitalization. A part of that, the treatment of the costs, especially of the costs which are related to surgeries, are very high in the private practice. And there is a low accessibility for patients to get in the public sector to do these complex procedures when the time comes. And what is the most important, if we would like to take into consideration when speaking about public policies related to cardiovascular diseases, and also to do good research in the direction of prevention and mitigation of all this public burden, is that we don't have aggregated data to use it and to do the activities that I mentioned. The last thing, which probably it's not so important, but it's also a burden, is the access to medications, which in some situations is a little bit prohibitive due to the high costs of the new antibodies that need to be used for severe dyslipidemias, which are not so easy to be provided for our patients. Next. If we speak about solutions that could be implemented in order to improve things around here, I would say that the public health campaigns are very much needed in order to raise the awareness as it should be, and to make people notice that they need to do more prevention in order to avoid hospitals. We will need to have more funding for healthcare infrastructure and for ensuring workforce capacity. This will also allow basically increased access to preventive services and policies. And we need to fight more against smoking and obesity. We also need to figure out a solution to build a telemedicine system, because this could provide coverage for rural area and underserved areas, at the moment not being functional in Romania, although WHO says that 70% of Europe uses telemedicine. Romania is not part of the countries that use telemedicine. And also we need to digitalize the documents and be able to create medical registries. Next. In terms of the lessons that we have learned, basically, from other countries, because in this morning I listened to also to the Netherlands Ministry of Health and Welfare, and he was speaking about connection with other countries and learning from other countries and implementing solutions. We need to recognize basically that prevention has a critical role in reducing the burden of cardiovascular diseases and promote these actions like physical activity, better nutrition, and especially smoking cessation for reducing cardiovascular risks. Encouraging regular checkups and especially implementing digital solutions for doing regular checkups in order to ease the access for the services for the population. It's very important in order to ensure early detection of risk factors and cardiovascular conditions. There should be efforts made to reduce healthcare disparities between urban and rural areas, because I could say to you that in Bucharest we have a lot of cardiologists, for example, but in the 5 cities that are neighboring Bucharest, we don't have more than 5 cardiologists added for all the cities. So this is a very big problem when it comes to the coverage of the medical services in Romania. And in terms of plans, we need to build up this national plan of cardiovascular diseases. We started working, we are in the process of working on building a national plan for fighting cardiovascular and cerebrovascular diseases, and to implement obesity programs, especially among children and adolescents, that could also change in 10 years the face of the cardiovascular risk in Romania. Thank you very much.
Thank you very much, Dr. Băsnatu, for providing these insights and also emphasizing the importance to speak out on the importance of cardiovascular disease, stressing the importance of secondary cardiac rehabilitation and getting more aggregated data, and listening to your lessons learned. Very insightful to learn about these disparities also between urban and rural areas in Romania and the availability of services. So let's now continue to Dr. Narain to learn